In today's COVID-19 update, Health Minister Dr. Frank Anthony is encouraging persons to come out and get their second dose Sputnik V vaccine, which became available on Wednesday morning. There are no first dose AstraZeneca vaccine. However, second doses are available and persons are being encouraged to come and get inoculated. Also, Minister Anthony addressed meals, transportation, and staffing issues at the Infectious Diseases Hospital at Liliendal.
In total, we are working with 5 different vaccines in Guyana: AstraZeneca, Sinopharm, Sputnik V, Pfizer, and J&J. As you would recall, that I keep saying, whenever we give out first dose of AstraZeneca, because it's the same vaccine that you do for first and second dose, that we'll issue about half of the amount that we have and keep back half for that second dose. So we have just given out half of what we have as the first dose, and that is why now we are no longer giving the AstraZeneca vaccine as first dose. The remaining doses that we have, we are now using that to give people their second dose of the vaccine. And so those persons who are now 4 weeks to 12 weeks after their first dose, or any time in between that, they can come back and get their second dose AstraZeneca. In the pipeline, we have a number of vaccines. They include more Pfizer, J&J, and some other vaccines that we're looking at.
Meanwhile, on the availability of Sputnik V second dose vaccines from Wednesday morning, Minister Anthony again urged persons to come out and get fully vaccinated against the coronavirus.
So as of today, as I've said before, we have Sputnik V second dose that is now available. And again, it's who need that second dose, they should come out now and get it, so that they can be completely vaccinated. We have distributed to all the regions. So right now in every region, the sites in those regions, they have second dose Sputnik. So first come, first serve. So go out, get your vaccine so that you can be fully immunized.
Minister Anthony also addressed several questions regarding staffing, transportation and meals for staff and patients at the Infectious Diseases Hospital.
So at Ocean View, I think we have an adequate complement of staff. Right now we have about 101 nurses that work at Ocean View, and we have 57 doctors that work there. We also have a number of ancillary staff that includes physiotherapists, pharmacists, biomedical technicians, laboratory people, and so forth. So there is an adequate complement of staff, and we have, because of the special nature of the facility, what we have been able to do is to have extended hours, how people are going to work and rotate their shifts. We have 2 persons who are contracted to provide meals for the Ocean View facility, 2 suppliers. And they supply adequate amounts of food for both patient and staff. Every morning there's a breakfast that is served at 6:30 in the morning. There's lunch at 12, there's dinner at 6 p.m. And for some persons who require additional food or snacks, that is also served.
With regards to transportation, Minister Anthony says while some persons prefer driving themselves, transportation is provided especially for the nursing staff to and from work.
So with our vaccination numbers today, we have 357,208 persons who received a first dose COVID-19 vaccine. That is now 69.6% of our adult population. And for second dose vaccination, we have 185,972 persons. That's 36.3% of our adult population. We also have 23,664 children who would have received the Pfizer vaccine. That's both first and second dose. So that now puts us to close to 32.4% of that age cohort.
Today's myth buster. Anyone who received a COVID-19 vaccine will not be able to donate blood.
Anyone who receive a COVID-19 vaccine, if you get a COVID-19 vaccine, the vaccine then stimulates your immune system to produce antibodies. And those antibodies are going to help to fight against the COVID-19 virus if your body encounters it. So that's how vaccines work. After your last dose, let's say if it's a 2-dose regimen, you will have on your second dose 14 days after, your body would be primed with antibodies. And at that point, if you would like to go and donate blood, there's nothing that stops you from doing so.
Well, that's it for today's COVID-19 update. Of course, we just spoke with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course, our social media platforms.